breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host and co-conspirator, Dr. Glenn Harrison. What's up, buddy?
I'm doing well. How are you on this fine evening?
I'm doing well. Yeah, I'm doing well.
Was it a good day?
It was good. Well, I mean, we had like some hellicious weather last night, so that was kind of crazy.
So the wind was blowing and trees were snapping.
Trees are snapping, hail. It's crazy.
Was it kind of nerve-wracking? Were you kind of grinding your teeth?
Gritting my teeth, yeah.
Yeah.
A little tension in the jaw, maybe
just a little bit of tension in the
jaw. So today we are going to talk about something that affects a lot of our patients in our practices, and that is temporal mandibular joint disorder, or TMJ. Mm-hmm. If this is your first time watching or listening to the podcast and watching on YouTube, please hit like and subscribe, turn on notifications, because we're going to continue to roll out new content each and every week, and hopefully we roll out something that applies to you. So without further ado, let's get after this TMJ issue, because a lot of people come in and they say, I have a TMJ. And I'm like, yeah, me too.
Yeah,
all of us have a TMJ, right?
But I think it's very important, because you can see the chronic issues that will develop if the dysfunction is too aggressive. And it just turns into a snowball of everything in the kitchen sink. And if there's no clarity and no certainty, and there's really not that, I don't really even see it at being a specialty. There's no doctor on TMJ, that's going to work with this dysfunction. It's kind of, people get bounced around to all sorts of different providers, and maybe they're not given enough of certainty and understanding of how it needs to be managed. So hopefully we can do that today.
Yeah, I think that when you look at TMJD, or temporal mandibular joint disorder, right? Mm-hmm. It can be incredibly debilitating, right? It can affect people's ability to talk, chew,
sleep,
everything. Can cause headaches. I mean, it can be pretty debilitating. So yeah, I'm excited to break it down, give some people some clarity on maybe some of the causes and some avenues that they can look at to maybe get this thing fixed. So
with temporal mandibular joint disease, I know there's a few different categories and origins. Do you want to jump into those?
Yeah, so it can be myofascial pain. So myo means muscle, fascia is the fascia around the muscle. So myofascial pain, so pain from the actual muscle surrounding the TMJ joint. It can be actually degenerative joint disease. So there's actually like a joint that your jaw makes, and it can be degeneration of that, or it can be internal derangement or misalignment with like in the teeth. You could have people that have, wisdom teeth that they don't know they have, or they have, an abscess or something like that too, that can be causing issues within the jaw joint as well.
And it's pretty common too. I know we're pulling out these numbers, right? Like 50% of individuals will experience some sort of TMJ dysfunction. 50%.
Yeah. 50%.
I'm happy I'm not in that. Are you in that 50%?
I've had issues
open your mouth slowly.
Nice. Let's see how nice and it glides, right? I've had it before, not to the point where it's like, debilitating, but it has caused me some significant discomfort. I know that if anyone has eaten next to my brother Dustin, buddy, everyone's like, this dude has some serious TMJ issues, because it sounds like you're sitting next to people like he might be chewing, like he could be eating ice cream. It sounds like he's cracking walnuts over there. It's so bad. So very common.
You'll have to send this to him after.
Oh, I'm going to.
Mad at you because you laugh.
Love you, buddy.
And another thing, and I've seen this, but I didn't realize that the statistic was so significant. Females to males 4-1.
Yeah, I would believe that. At least seeing it clinically.
Yeah, I've never actually clinically seen a male with it. I
don't know that I have either, actually, now that you say that.
Yeah. So that's a higher risk factor, and ages 20 to 40 most commonly affected for whatever reason. I don't know why. I guess that's just the stats. So I know we always like to talk about causes in TMJ. Oh, there's lots. but you want to get into a few of the causes, and we'll try to keep it.
Yeah. So, well, how about this? The most common causes that we see in our practices, right? So the biggest one for us is that there's a little disc that sits between your jaw and your temporal bone, right?
Yeah,
So
the
the
jaw is
TMJ.
pointy.
Yep.
Jaw has the point, the pin, and the socket is the I guess
The cup.
the cup. Mhm.
So what it is there's actually a little disc in there that provides lubrication between your jaw and your skull, right? Your temporal
Now
bone.
I'm moving my jaw here just to make sure.
Just feeling it. So if you have an issue with that disc, now that disc moved, or the disc is maybe inflamed, or the disc is irritated, or whatever it is, then you can have either hyper or hypomobility within your jaw. And what that means is that if that disc isn't where it's supposed to be and it's not lubricating that joint the way it's supposed to, then it's obviously not going to move as easy as it should. And it's also going to be more painful because the bone is going to have increased friction between the two portions. So that can be a really big common cause of it. You can look at people with like tension in their jaw where they're like gritting their teeth all the time, or they're super stressed out and they're gritting their jaw. So something of somatic origin, like the somatic is muscle, trauma. So people,
Car accidents, whiplash,
broken jaw,
yeah,
whatever. That can definitely play into it. And then like we talked about, you can have like degeneration, or you can have a comorbidity. So you can have like a degenerative arthritis or an autoimmune condition or something like that.
And then, just to touch on that a little bit, we're talking about the TMJ, we're talking about that little joint, but it's influenced by all of our cervical spinal muscles. So a lot of times when people have TMJ dysfunction, you look at their neck and it's lit up. They're tight. Muscles are tight. Everything is locked up. And so any kind of therapy should also look at the other parts of it, because everything kind of bleeds together. All the fibers are running together right to the jaw.
Absolutely. Absolutely. And then actually the last one that I was going to talk about, which is what caused mine, is like dental appliances. So I had like braces for probably and when I say probably, it was most definitely 10 years. And a lot of jaw work going into that because I had a pretty significant like underbite. And yeah, so when that was a big thing where I had like a lot of jaw pain from doing that. So definitely considering that as like, a comorbidity as well.
Mm-hmm. So, the common signs, symptoms, and all of that, I know there's quite a bit. And if anybody's listening to this, they're probably trying to get answers, and maybe they bounced around from different providers, or, they hear clicking. But, that popping and clicking, as you said, that was your brother? That was your brother?
Oh, it's terrible. Yeah. Yeah. If you have a question on what TMJD is, just I'll
audio record. I'll
put a video of my brother up on my website.
Wow. But yeah. Also, you'll see headaches and neck pain. Again, as I was talking about the cervical spinal muscles, jaw pain, even ear aches. I've only seen that once with TMJ dysfunction, ear aches, pain with chewing. Have you ever seen neurological issues?
I mean, there's obviously there's musculature associated with your jaw. So like any sort of deviation could be that,
like trigeminal neuralgia. Do you ever?
Yeah, for sure. Like dental pressure in our teeth and all that kind of stuff. You have a sensory nerve that goes in through there. So definitely, I mean, I've never seen it, but I could see that being a possibility. Whereas if you had a bunch of dysfunction in a joint and there was swelling and all that kind of stuff in there, that it could press on a branch of the trigeminal nerve distribution.
Yeah, so the trigeminal nerve is kind of the really wild, intricate set of nerves that are kind of running right over mandible from.
Yeah, there's 3 branches. One goes above your eyebrow, one goes kind of like down on your cheek, and the other one goes down your jaw. So I could definitely see it hitting one or multiple branches of that nerve distribution for sure. Yeah,
and another thing, and I know we never really talked about this, but when people open their jaw, I think you remember that in school. And you can do it in the mirror if you're watching this or after this. Open your mouth and watch your lower jaw and your mouth if it deviates into form of an S. A lot of people don't have the perfect open and close smoothness, but you can see where your lower part of your jaw will deviate to the right or to the left, and it'll be very subtle. So do it slowly. And if you are dealing with these issues and you see that, well, it's pretty obvious, it's black and white, that something needs to be done. Yeah. So speaking of that, what are some management strategies of of this, and what, and or how would you diagnose it other
Yeah.
than opening your mouth in the mirror?
Yeah. So obviously watching, that's the biggest part, right? Because it's very easy to have someone else, especially someone who's familiar with it, to do it as well during an examination. So an examination, obviously, to look at the joint, look at how the joint is moving. It's kind of an interesting joint because not only does it pivot, but also glides. So it hinges and then it slides forward slightly. So making sure that you have a qualified professional looking at it. Another one that I've done before in the past is actually taking like x-rays and imaging to see if the joint is maintained, the joint space is maintained, to make sure that there's no sort of like destructive lesions or anything like that going on within the joint. That's a good point to start at. But there's really no substitution for a good physical exam, especially if you're having the pain and issues in the joint. And then you can also, if it's dictated, you can make the appropriate referral. Does this need to go to a dentist? Does this need to go to a cranial facial surgeon or whatever?
That's right. Yeah. And then there are management strategies I know you and I both have done in our offices. I know you said you refer to your wife quite a bit with TMJ issues, but myofascial work is a big thing. If you can get those muscles to calm down, that will pull the joint out of alignment and create more and more dysfunction and more trauma on that joint. I think a lot of people forget that this joint, in fact, my sister dealt with this for a long, long time years ago, and I don't know how she's doing now, but there was a constant clicking. I don't know if it was as bad as your brother, but there was a constant clicking and clicking and clicking, and it would create headaches, tension. And I always thought of over time how much arthritis is going to develop as a result of that excess strain on that joint. And that can get nasty. Arthritic buildup over something where there's all these nerves and intricate hardware around that joint. So, but myofascial work, strengthening exercises, manual manipulation, I guess that's kind of both our world and your wife's world. That can be pretty powerful, but it can't only be the jaw, the cervical spine, the neck muscle should be evaluated as well. Yep. There's other therapies. I haven't used really any other therapies. Have you, like electrostim and stuff like that?
Not on the jaw. Not really, but you can, exercises, rehabilitative exercises, and then
appliances and
dental appliances. It could be, even something like surgery in some cases.
Yeah. And orthodontists are very good with this as well. So, depending on what you've done and what is found, that's always a great source. They're looking at the bite and all of that all the time. And of course, there's surgical procedures and things like that if it's getting out of hand. Ideally, you want, like anything, you want to catch it early enough so things don't get out of hand and you start building a bunch of arthritic buildup before things get too out of control.
Absolutely. Mm-hmm. So if this was you and you're popping, clicking, and grinding when you're chewing, or you wake up with a headache, or you're grinding your teeth down to nothing, then definitely consider TMJD.
Yeah, and don't ignore it, because this is serious, and it's a very intricate joint that you need every day.
Yeah, I mean, we're using it right now.
Yeah, that's right.
So if you guys got value out of this podcast or this video on YouTube, again, hit like and subscribe, turn on notifications, and stay tuned, because we're going to continue to roll out new content each and every week, excuse me. If you'd like to get a hold of us, you can do so at our email associated with the podcast, which is info@brainstormingwiththedocs.com. You can get on our websites. Mine is www.northlakeschiropractic.com, or you can get on Dr. Glenn's website. His is www.drgharrison.com. And again, stay tuned, because more content to come.
That's right. Well, that was good, Dr. Kolby. Yeah, and your brother will probably be reaching out.
Dustin, sorry, buddy. I'm sorry, Dustin.
Okay, we'll talk to you next day.
All right, bud. Bye.
Bye.